Hello, this is Lynn Lucas Fame. I am the president of the Pennsylvania Medical Society, and I'm honored to have with me today Dr. Robert McNamara, professor and chair of emergency medicine at the Lewis Katz School of Medicine at Temple University. To tell you a little bit about Dr. McNamara, he received his MD from Jefferson Medical College and did his residency in emergency medicine at the Medical College of Pennsylvania. He's board certified in the from the American Board of Emergency Medicine and is a member of the American Academy of Emergency Medicine, the American Medical Association, and the Pennsylvania Medical Society. He has received numerous awards and honors. I can't name them all here, but just to give you a few, he won the Peter Rosen Award and David K. Wagner Awards from the American Academy of Emergency Medicine. He also has received the Master Clinician Award from Temple University. And there's even an award named in his honor from the American Academy of Emergency Medicine. Obviously, that is called the Robert McNamara Award. But instead of reading you his incredible CV, let me tell you the reason why I really am so looking forward to speaking with him. As many of you know, part of my priority this year has been to take a closer look at private equity and the corporate influence on medicine. Dr. McNamara is an expert on this, and so I want to thank him so much for giving me part of his time to educate all of us on private equity.
Well, great to be here.
All right, so let's just get right into it. You've been involved in fighting corporate influence in emergency medicine for over 30 years. Can you give us some background on how you became involved in that?
Yeah, so it all started with a book called The Rape of Emergency Medicine. I probably wouldn't title it that these days. But essentially, the book detailed what was going on in the real world of medicine outside of the academic arena, where docs were going out and basically they were being exploited. They would sign a contract and somebody was making a lot of money off them. They were, basically a labor force. And I read it, and at the time I was residency program director, and I said, if this is what's going on, I mean, I ought to get involved because our graduates are going into this world. I contacted the author, a guy named Jim Keeney, who was the first president of the American Academy of Emergency Medicine. And he said, this is all true. This is actually my story. I wrote it, and this is what's happening in the real world of emergency medicine. And he had a survey in the book, and I said, if this is going on, I ought to get involved as an academic or program director. And the quotes from that just blew me away. It was things like, after 9 years of abuse, I'm leaving emergency medicine, leaving my residency, like leading a lamb to the slaughter. One guy said, had I known we were trained to be cotton pickers for the national groups, I would have never chosen EM. So I got into it, I got into research, and basically, I made the connection that as an academic, I was protected, I ought to speak up, I ought to get involved, and it's the future of our graduates, but they're going into the real world. And, I kind of added that into my focus, along with the program director, doing all the typical academic stuff. And was on the family board of the American Academy, wrote the original mission statement, actually served as president for 5 years, still involved. I'm the chief medical officer of the AAM physician group, which tries to protect existing physician-owned groups and get new ones into business. And, like we're working with groups in the area, I just had, a big interaction with Mainline Health Emergency Associates, and they, we're helping them out because, some hospital pressures are going on. So that's how I got started.
So how did private equity infiltrate emergency medicine? How did it get such a foothold? How was that allowed to happen?
Well, unfortunately, the story is, it's great. It's all about money, but it's a lot of things in life. Unfortunately, this was an issue created by physicians, like a lot of things are in medicine. We kind of shot ourselves in the foot. And it's described in the book, The Rape of Emergency Medicine, the entrepreneurs, the people who saw an opportunity to gain the exclusive contract for an ED and then to make money off their colleagues. The book describes, what happens. Like, hey, we did it in one, we can do it in more. We can do it in multi-state groups. And it was really started by so-called leaders of the specialty. One of the biggest companies, Envision, that just went bankrupt, its forerunner was AmCare. That was founded by the 1980-81 president of the American College of Emergency Physicians. And there's a whole list of leaders who came in, and basically they were, not working any more shifts. They were making a lot of money, and they kind of suppressed things that were going on. I mean, the original bylaws of ASAP said you shouldn't work for companies. You shouldn't exploit your colleagues. It was very similar, language the AMA had put forward in its early years. And then, how private equity got involved is they realized that, hey, I'm getting close to retirement. I can sell my multi-state contract company to a lay entity and make my retirement nest egg. So that, Riggs, his big sale in 1996, he made $40 million selling to Laidlaw, which was, a bus company, an ambulance company. And Laidlaw then sold to Onyx. And then, because private equity saw, hey, we can make a lot of money here. And EM, like I say, it's the primary cancer, and we've metastasized to other specialties. We were easy prey for a couple of different reasons. One is, we don't have an office. We don't hire the nurses. We don't hire the clerks. It's labor. It's managing whoever's seeing the patient. So there's not a lot of practice overhead. And, the docs that go into emergency medicine are not, we're not your plastic surgeons. A lot of them have strong sense of social justice. They were easy to be taken advantage of. And, that combination, the leadership telling us that this is the way it should be. And this all kind of, reading the book, I realized, like, wait a second, this is a classic case of greed. We made a mistake. And then private equity just swept in, and they've upped the game, right? They've, we can talk about how private equity operates, but it's, raised the charges on the patients. Emergency medicine helped lead the charge for the No Surprises Act, the balance billing. We could talk about that. Docs would not see what's billed and paid in their name. What's the number one expense? The doctor's salary. So let's replace the doc with a non-physician. So the evils have abounded. Now, there's fortunately been a major pushback led by the American Academy, and even the ASAP has gotten on board now. They realize that the rank and file member does not endorse the current state of affairs.
So what effects have you seen first on the physicians who are in it? What is it like to be, after this infiltration of private equity, to be a physician? And how about on the whole specialty as well? What has changed due to it?
Yeah, I mean, if you look at the arc of emergency medicine, we were first told we weren't needed. This is, we don't need specialists. And we essentially grew pretty rapidly. It, in its purest form, I still, as a chair of emergency medicine, think it's the greatest specialty out there. I mean, what you get to do, the things you get to do for patients. We've developed a research base, academic departments, deans of medical schools. The president of the AMA was an emergency physician. So the specialty rose, but then, we ran into this wall where, hey, there aren't any more good jobs out there. You got to go work for private equity. All the private group jobs, they don't turn over. So as a physician, if you look at the surveys, we're number one in burnout, right? That's clear. I mean, we've been like 10% higher than the next specialty in the Medscape burnout surveys. A lot of that is just sort of the baseline stuff that you can see on the pit, right? I mean, just what we deal with. I mean, we see kids die. The ills of society, domestic violence, substance use, obviously at Temple, penetrating trauma, kids. So it's an inherently difficult specialty. You throw one at it's 24/7, right? You got shift work, you got nights, you got weekends, you got holidays. You can't, and the basic premise, and this is why I got so engaged in it, and I still have passion for it, is that the basic premise is you can't do a difficult job long-term if you feel like you're being exploited. If you feel like you're being taken advantage of, you're going to burn out. And that's what's happened to emergency medicine due to corporate influence. They feel they're a cog in the wheel. things are hidden from them. There's no transparency. The director who is the agent of the corporation doesn't work shifts or works like 1 day shift a month. And it's just, it creates that underlying, like, here I am at 2 a.m. on a holiday weekend dealing with this, and I'm burned out. And it's along the way to burnout, what happens to the physician, right? They get angry going into work, they're angry coming home. It affects them personally. It certainly affects their family. It affects the quality of care that they give to the patients. And now we're seeing it. We're seeing early attrition. Women emergency physicians leave 12 years earlier than male emergency physicians. That's probably because they're smarter than us. They're getting out of the pit. When I testified, submitted written testimony to Oregon, which just passed the CPOM bill, my opening line was, watch a couple episodes of The Pit and tell me if you think private equity should be in our nation's emergency departments. It's absolutely, they should not be there. What we deal with, you can't have that profit motive in there. And it's, as we talk, raise the charges, you can only do that so much, and then squeeze the coverage, like get the individual doc to see more patients per hour, metric them on that. And then, hey, why do we have double covered docs? We can hire a couple PAs or NPs, replace the doc, and make those docs supervise them, even though they don't have time to do it. So that's been, a big effect. And obviously all this stuff, the burned out doctor, the non-physician seeing you, trickles down into the patient level, right? It's going to be poorer quality of care. So it's a really, and EM's declined, right? We used to be right up there with ortho and everybody else with the highest number of US grads, highest number of applicants per spot. And now we're struggling. We had a couple of years ago, some of it was the pandemic, but we had 550 open slots where 5 was the usual for each year. And so there's been a decline in the interest. And again, that means the best and brightest are not going into emergency medicine. So it's another effect on the quality of care. So it's been the worst thing I think that's ever happened to emergency medicine. And the terrible thing is we opened the door to it, and we weren't wise enough to shut it early, and hopefully other specialties take a lesson from what happened to our specialty.
Well, let's look at that. You said you hope other specialties will take a look. Do you think that the other specialties are getting the message? Are they seeing, are they listening to what you have to say? Are they seeing and recognizing what occurred in emergency medicine and trying to not let it happen to other specialties? Or is the same thing happening over and over again?
Well, unfortunately, the same thing is happening over and over again. I mean, and this was a generational sellout, right? So the docs that held the contracts, they sold out the future of the younger physicians. The discontent among the younger physicians has driven the professional societies to, primarily the ASAP, because the AAM was founded on one of the principles that we don't want corporate emergency medicine, has driven them to change. And of course, they said, hey, we can make money on emergency medicine. Where else are we going to go? Other hospital-based specialties, radiology, right? Rad partners, anesthesia groups, Envision, which MCare we just talked about, Team Health, they have anesthesia, they have hospitalists. Early on, like, we were contacted by the guy who founded hospitalists, Dr. Williams from San Fran, and says, look, we need to learn some lessons from you. And I sent him the book, The Rape of Emergency Medicine, and talked to him. And he says, you know what? We're already over the cliff. The leadership of the Specialty Society, the Society for Inpatient Medicine, is infiltrated with, these cogent, these big type groups that are, following out the private equity. So there hasn't been occurred. So what we're seeing at the level, and this is occurring all over, even at the AMA, you're seeing doctors who don't want private equity. And the game has been heightened by the involvement of private equity with hospital closures, not just physician practices. We have another group called Take Medicine Back, which is multi-specialty. So we've got players from emergency medicine, radiology, anesthesia, dermatology. We've got the dentist. I've been speaking to the dentist. In September, I'm going to lecture to the independent dentist group, because Aspen Dental, all these other things, Delta Dental, private equity, they're feeling the same effects. Veterinarians, you can listen to a 2-part podcast on Freakonomics about, can you trust your vet? Because, they're all owned by private equity and they're cutting costs. So there's a a big movement, and some of that has driven, these are the people behind getting the Oregon bill passed and, raising the stakes to get things done in states like Pennsylvania, where there does exist prohibitions on the corporate practice of medicine. I encourage all the young docs to say, look, AAMs, we're doing this, but you ought to get involved with your state medical society because they have the clout in your state, and you ought to consider getting involved with the AMA. And fortunately, some of them have stepped up. We've gotten multiple delegates now to the AMA who are infused with the mantra of private equity doesn't belong in medicine. So it is, the tide is changing, but senior docs are still selling out. Fortunately, the game, it's out there now. It's exposed, and people realize that private equity really does not do what it says it does. It's coming in to make money on a short-term basis, and the way they do it harms the patients. And obviously, as doctors, we swear an oath to the patient, so we really should not be engaging in abetting private equity.
Yes. Now, you mentioned the groups forming, like Take Back Medicine, and what other things have happened? I think you were firsthand involved in a lawsuit that tried to stop this. What other things have occurred just to try and go and directly fight the infiltration of PE into medicine?
So there are, in 30 plus states, existing prohibitions on the corporate practice of medicine. Now, you're an attorney, right? There's prohibitions on the corporate practice of law, which is even more prevalent and more enforced. I mean, for lawyers, it said that, you can't have a corporate influence between the client and the lawyer. For medicine is you can't have the corporate influence between the physician and the patient. I would argue the latter is a little more important. You can be disbarred, right, if you do it. So realizing that there's a prohibition on the corporate practice of medicine, I actually learned this through my involvement as a young physician with the Pennsylvania Medical Society on the board of trustees. Like, oh, wait a second, there's already laws that say we shouldn't do this. So we have taken to trying to pursue that in California. So we have engaged in litigation against corporate emergency medicine through the American Academy of Emergency Medicine a couple times. One time we didn't get standing in Texas because the physician who was working for one who we filed on behalf of, they got fired. We had no standing. So we created the physician group to bind groups to us. And one of them lost a contract to Envision, former MCare combination with AmSurge, owned by KK&R, the big Wall Street private equity firm. And so we sued, saying Envision cannot own this contract in the state of California based upon existing prohibitions on it in California. And what the whole scheme is centered around creating a front professional association. They have company doctors who essentially own the professional entity, and that's the vehicle they say that makes them legal. Now that is, they're, these are paper owners. It's, this is a veil that can be pierced, and there's already case law in Texas. There's other rulings in other states that says, this is not a structure. This is a ruse to get around the prohibitions. So like this company Envision, we have proof that one doc testified in court that he held at any given time up to 300 professional entities in 20 states for Envision. I'm the owner of 300 different practices across the country. Clearly a scam. Now, this is a doctor who is aiding and abetting the corporate practice of medicine. So state board should take a licensure action, but we go to court with that. We basically went to court and said, we think this is a scam. They filed for a motion to dismiss, saying this should go to the Board of Medicine. And the judge looked at it and said, if what the Academy is saying here is true, you guys are completely in the wrong, and you're going to lose. And what happened was Envision actually pulled out of the state of California to make the lawsuit moot. When you think about that, this big this was a $9 billion purchase to leave the state because a small professional society stood up to them, which would potentially disrupt their operations if they had a court ruling in other states. That shows you the cloud of what physicians can do when they're arguing. You don't need a new law. In places like Texas and New York and Pennsylvania, we haven't challenged it yet, but it's subject. There's a couple different things. There's some prior AG rulings. So this is what we're doing. Now we're trying to also get better laws in states to get them enforced. And you're aware, I know you're aware, that Oregon just passed a really good law, which focuses on this, fake owner, this MSO that actually controls the practice, and said, the company can't do this. They can't tell, who to hire, who to fire. They can't tell the doctors how many patients to see. They can't control. There's got to be a separation there. An MSO, which a lot of us use anyway, can do the business functions, but they can't dictate the care of the patient, the billing of the patient, the control of the practice environment, like who's seeing the patient. So the Oregon bill is a great first start. So again, we're working in multiple different areas. We've pursued, actions with attorney generals. There's some stuff cooking right now in front of the North Carolina Attorney General, and then, trying to get bills passed, and hopefully this bill in Pennsylvania, will move forward. I know the Pennsylvania Medical Society is behind that. You're involved with that. So there's, action can be taken. People are talking about a federal bill. That's probably pie in the sky right now, but certainly state by state, we can take this stuff down.
So let's talk a little bit about, we talked about the specialty, we talked about the physician groups. Let's move over to the private equity influence on actual hospitals and buying hospitals, and this is something that affects both rural and urban centers. I mean, here in Pennsylvania, the recent closure of Crozier, but also in the northwestern part of Pennsylvania, there was a small hospital that closed that was owned by private equity called the Sharon Hospital that has been able to reopen after some attorney general involvement. So I'd love your take on that, and specifically some of the tactics that are used at the hospital level when private equity comes in with the promise of infusing funds. A lot of these hospitals are challenged for funds, and then they turn around and do something like one of these real estate investment trusts where they actually take the property. They take the buildings and force the hospital to have to lease buildings that they previously owned. So every trick that they can think of to extract money for their investors is being utilized on these hospitals that already are in precarious positions. What is your take on that, and how do we work on that so that we don't end up with an entire community like in Delaware County right now really is challenged to get the health care they need?
Yeah. So, I mean, obviously, this is bad for the patients, for the communities affected. The one thing, you like, what is the good point of all this? This is, when we were arguing for the last 30 years at the American Academy of Emergency Medicine that they shouldn't own physician practices, it's kind of hard to get an audience. Like, you rich doctors, what are you talking about? Oh, you're not making X amount and they're taking money out of your pocket. You still got a job, don't you? So we had a hard time getting traction. But, as it spread to other specialties, we've been able to get more support within medicine itself. But the effects of private equity on, what you said with the Hahnemann, with the Crozier, with, the Stewart system in Massachusetts, this is, raised the stakes because now the public is affected, and the public is going to their legislators and saying, what the heck's going on? We're pissed. We can't get care here in the city of Chester. So it's obviously terrible that this has happened, but the good news is it's elevated the whole, why is private equity in medicine? And we as physicians have to say, we've been talking about this, like they're also doing this to us. And if you care about patient care, it's not just the hospitals. So we need to make sure that we seek, when there is legislative movement and things happening, that we also protect the independent physician practice, which, you'll agree, and I know your background is that's the way to go. I mean, physicians working for other physicians on behalf of the patient, behalf of the institution that they serve patients at. That is, what is needed in this country. People who are going to fulfill their Hippocratic oath. So, the typical deal is, I mean, these are all like suffering hospitals that they come in. And as you said, I mean, they basically come in to make money, right? Private equity, that's their goal. I mean, what is private equity? They have managers who, always make their 2% cut, and then they make, a percentage of the profits. So the private equity managers, they're paid no matter what. And then they get in people who invest their money, who expect a major return on investment. 15, 20% return on investment. Well, how do you get that return on investment with a struggling hospital? Do you bring in more doctors, buy more equipment, amp the volume up, change the payer mix in Chester? No, that's not how you do it. You come in and you basically, I guess the word is rape the hospital. You basically sell off the assets, you sell off the land, you do to these real estate investment trusts, you get a big chunk of money, and then you pay yourself a dividend. Then you take out loans, okay, to support the ongoing cost and the need to pay rent. And when you get a loan, you give yourself another dividend. So they make their money up front. Like the purchase prices for Hahnemann and Crozer, that was covered pretty quickly early on. And then, whatever happens, happens. We've already made our money. Let's get, maybe we get some more money from the state. It's a sad story. There's a couple books out there that talk about private equity throughout industry, right? It's not just hospitals. I'm in a chapter on a couple of books. They both have, plunderer in the title. One is by Gretchen Morgenson, the other by Brendan Ballou. And they basically talk about how they do it in other industries. Toys R Us, private equity, tore them apart. So it's the same thing. You come in and you strip the assets for money, and then you decrease the workforce. There's rare examples. I'm not aware of any example where private equities come in and like save the hospital and then spun it off and made it whole again. That's what they claim they're trying to do, and I don't really think that's true in healthcare. The nursing home industry, okay, there's chapters in there. I mean, that's where it's really, been a major effect. They've gone in and bought nursing homes and done the same thing. They've sold off the land, make them pay rent, and they cut the staff, and the outcomes are poor, and more falls, more bed sores, that type of stuff. So that's their game plan. They're coming in to make money for their investors. That's all you got to know. Private equity can paint it however they want, but we hear the word profits over patients. That's what's going on.
Right. So with all this that and have personally experienced, what kind of advice do you think that we should be giving to our fellow colleagues in medicine, especially those new ones coming in? When they go to sign their contracts, sometimes it's not so clear whether there is private equity involved necessarily in the practice, in the hospital. So what advice would you give for someone coming in that's entering our profession that's new, that and maybe not as aware? Is there anything they can do?
Yeah, you wouldn't think, ideally we wouldn't have to worry about this stuff. Like you go in and you learn the medicine, the science, and you take care of your patients. But you have to realize, just as there's social determinants of healthcare, there's now financial determinants of healthcare, right? The financialization of medicine. And it's corporatization, right? This is what's going on. It's people trying to make money to squeeze more out of the patients and the system. So you have to wake up to the fact that you're going to be dealing with corporate entities. And if you work for a hospital, they've grown, they've consolidated. As a medical staff member, you've got to be vigilant as to what a hospital can do. Out of mainline, they tried to bring in sound physicians to take over anesthesia. Fortunately, that medical staff rose up. So you got to be willing to be active in your medical staff. Okay, if you're in a hospital, you definitely ought to consider membership in organized medicine. Your county, the Pennsylvania Medical Society, the AMA, see what your specialty society is doing. Try to put pressure on them. Like, what are we doing about this? Why are we allowing, this business to infiltrate our relationship with the patient? And it's amazing. I know this from, having served on a board of many societies. The single voice, when you send an email of complaint to the board of directors, if you're a young physician, they say, oh, there's our future membership. Well, we better pay attention to this. So you'd be surprised how powerful your voice is as just an individual young doctor. And it's their future. I mean, are you going to want to go work for the man, not have that independence, that autonomy, the ability to act on behalf of your patients? I mean, we didn't even get to talk about the whole fact that, I did research where if you work for these companies, you get no due process. They will fire you at the hospital's request. You can't speak out on behalf of the patient. So you have to understand, this is like one of the crises of our time, right? We had the whole thing, but socialized medicine, HMOs, this and that. Now this is private equity. So getting engaged, taking the time, and as you're aware, it's very easy to rise up. Like I joined a young physician section, and the next thing I knew, I was sitting on the board of trustees at Pennsylvania Medical Society, listening to all the collective knowledge and wisdom. And then I took that into my career, and that helped me, form the American Academy. So it's not that difficult to get involved, and people will welcome you with open arms. So again, you got to live your life. You got young kids, you got debt to pay. It's understandable, but at some point, things are going to open up for you a little bit, and maybe then you can say, okay, let me go to a medical society meeting, or let me shoot an email to somebody like, hey, I'm interested. What does it take to be a delegate? And you'll be surprised and it helps you feel like you're doing something too. It's another way to combat burnout. That you're feeling you're trying to change medicine for the good.
Wonderful. Is there anything that I didn't bring up this conversation that you think that the people that are going to watch this should know? Anything else or anything? I just want to make sure I gave you the opportunity to give us your knowledge.
Yeah, unfortunately, what happens as you trickle through medical school, and this happened to me, is you hear, oh, the AMA, all they care about is their pocketbooks. Like, well, actually, that's what's really important. I mean, somebody's got to care about the financialization of medicine. So there's this sort of, general physicians have this negative attitude towards organized medicine. Now, they have less for their specialty societies. Oh, well, they're fighting for our specialty. So, that to me is, one big thing that people need to realize, that there are very few voices on our behalf, and the ones that are really listened to are the state societies and the AMA. And if you can find it within yourself to join and try to get active, you can have an influence. You can be important to shape the future of medicine. And just be wary. I mean, the wolf is at the door. Private equity wants to come in and make money off of you and your patients. Be aware of your circumstances. When you hear things going down, if you're on the medical staff and they say, hey, we're going to bring in a new radiology group, check it out. Or we're going to bring in a new emergency medicine. Medical staff has power. The Joint Commission invests us in the quality of care. We're supposed to be responsible. You have a say on any exclusive contract. So there are things you can do as a physician. Again, if you can't get involved in a society, participate in your local medical staff. Be a player, go to their dinners, make sure that you can, again, watch out for corporate influence on what's going to affect your patients. So pretty much it. I mean, it's, like I said, it's been a rewarding part of my career. Like, I really feel like, we've had some success. We've started to turn, the direction around private equity is not growing in emergency medicine. It's abating. So there are examples where it took years, but we knew we were doing the right thing, and now we're seeing the fruits of the labor.
Wonderful. Well, thank you so much for doing this. I think our members really do appreciate these talks from various people, and for people to have the opportunity to really just educate people on things they don't really know about. So thank you for your involvement, and thank you for helping me with this.